Hello, ladies and gentlemen. Welcome to another episode of Men to Men Podcast. I'm Malik Carey along with my co-host, Brett Cowell. Brett, what's going on, man?
Just enjoying this weather, my brother.
It's, finally.
The weather's breaking and playoffs are in full swing great time of year, man.
Oh, it is.
I'm even getting into some hockey.
Hockey? Oh, yeah,
I'm
man.
enjoying hockey for crying out loud. And,
I'm not there yet, but I'm just happy that it's golf season, man. You
you do your golf, bro.
Yeah, brother. I can't.
Do your golf.
Yeah, just a beautiful place to be right now. So
I can appreciate that.
I've already hit the links a couple of times, and getting this back in getting order, and just really ready to enjoy the summer, man. Any plans?
Not really. Just wake up and be excited about what the Lord has in store for me on that particular day.
Amen.
I'm sure we're going to do some traveling. Wifey Pooh is going to
figure out something for you. I think we're supposed to be going up to Canada.
Yeah, Wifey Pooh's going to put together some travel plans, I'm sure, and just having a good time, my brother.
All right, man. Good. I'm excited. Well, man, we've been talking about mental health, and this is Mental Health Month. What are we talking about today, Brett?
Anxiety.
Oh,
last week we talked about depression and spent a little time talking about how what the impact of COVID had on the Black community, and so today we're going to talk about anxiety and we're going to look at some other things as well. Bipolar depression is something else we're going to talk about, and then we're going to close out with schizophrenia. So we'll start with anxiety. Real simply put, anxiety is one of the most common mental health illnesses affecting America. It's defined as a constant state, and the key word here is a constant state of irrational fear or worry, or any impact that it might have on a future event, or any response that one might have on a future event. It's marked with an inability to cope with normal day-to-day activity. It's characterized by panic attacks, social anxiety, and about 10% of teenagers in this country are affected by anxiety, and about 23% of adults.
Wow, that's a big number.
That's a big number, are affected by anxiety. And so just real quickly, when we look at the Black community in particular, again, it's just like we talked about last week with depression, man. Blacks look at anxiety as a stigma.
Yeah, man. I mean, and I think that there's something we're going to keep drilling home is we have to get away from these stigmas. If you need help, go get help. Right? Period. And really, when we talk about, some of the causes of of anxiety, it's really, believe it or not, it goes back to trauma.
Right.
Right. It really goes back to trauma and early abuse, family history, environment. Right. Those type of things have really plagued us for so many years. And when we think about that, family history includes genetic and early environment.
Right.
Something I talk about, nature, nurture. Nature, nurture. So you understand what that is. Nature is your DNA, and nurture is the environment you were raised in. And if you've had an environment that was traumatic and a lot of fighting and a lot of those things, you're going to have those. Again, shy or inhibited temperaments. Certain medical conditions, including heart arrhythmias and thyroid conditions. These are things that we don't talk about. Black Americans face, additional risk factors for anxiety, including racial trauma. Right, and these risks include exposure to racism and racial abuse. The effects of racism, such as fewer opportunities and less safe communities. Didn't we just talk about that a few months ago? Wow. Higher rates of trauma include sexual abuse and police violence. These are things that are really at the forefront. Having less access to safer communities. Just think about that for a minute. You know, that's something we don't really understand that really helps us. You know, and we've been talking about it. Less access to opportunities for better educational systems and jobs and healthcare and financial institutions. You know, going into a place and knowing you need to borrow some money, you know, and you got the credit, you worked hard, you may be a little behind, and they're denying you, you know, and those type of things.
All those things you mentioned, basically.
Phobias, real or imagined. You know, a lot of that stuff it works. I mean, it's there.
Yeah, a lot of the things you mentioned is the reason why anxiety is the second most prevalent mental health issue in the Black community. I know earlier you talked about there's no difference statistically between the prevalence of anxiety between Black and white communities, but
Actually, the whites have a higher rate.
they have a high okay, they have a higher rate, but anxiety is the second most. That's a good point. Thank you for clarifying that. But the reason why we're talking about anxiety, though, even though it might not affect us as much as it does them, when it comes to the Black community, anxiety is the second most prevalent mental health illness reported.
Oh, big time. Yes.
And the other thing that's significant, I think, is that since the George Floyd death, since his death and since his trial and since all the protests and all the conversations around that, depression and anxiety have increased in the Black community. And I think you mentioned this before. The whole terminology, the whole term of post-traumatic stress disorder has doubled.
Oh, yeah.
In the Black community in more recent years. So even though the reason why I bring this up is because even though we may not suffer from anxiety as much as the white community does, this is the thing that affects us the second most when it comes to mental illnesses.
No doubt. And we want to be, you know, in no way do we want to not be sensitive to that. Yeah, it affects us big time.
Yeah.
Yeah.
What are some of the causes, though? What are some of the things that cause us as Black Americans to
well, we talked about, you know, early trauma, you know, I mean, it really did. I mean, when we really think about it, it goes back to trauma, you know, and how we've been taught to deal with our trauma. You know, it's something that we have not done well. I mean, we talked about it last week, you know, some of the generational stuff that's been passed down from generation to generation, the racial abuse, and, you know, do you remember there was a time, I don't know, I know it was my era, where you were just even afraid to drive through different neighborhoods because of the fear of being pulled over by a police officer. Like, I remember you couldn't go on the parkway down by that exit of Cranford and all of those areas because you were afraid you're going to be pulled over. That's anxiety. That's, you know, those are things that you got to, or when a police, I don't care how great your paperwork is, how great it was when a police officer just got behind you, whether they're going to pull you over or not. You know, today, when I look in that rearview mirror when a police officer's behind me, you know, those type of things, paperwork's great, very successful. Those things cause anxiety. Right. Mm-hmm. And when we start to think about that, you know, we're thinking about those type of things that are causes that really start to plague at us. You know, when I don't have the access to the finances, or when I don't have access to the community programs that others do, you know, when I want my children to grow up a certain way, but I'm afraid for them that they're not going to have what I want them to have. Those are all things that cause anxiety, right?
Yeah. What about? I think stress causes anxiety. Is there anything that speaks to the whole concept of stress as it relates to anxiety?
Yeah, I mean, when we think about stress, you know, again, when we go back to having less access to safer communities. think about that. When we have those type of things that are going on that cause us stress, I can't find a job. That causes me stress. I'm not making the money to pay my bills. That causes me stress. I'm not being able to provide for my family the way I should be able to provide for my family. It causes me stress. Those are things that cause stress, right?
Yep.
So when we think about those things cause me stress, and they keep me up all night because I can't pay my bills. They keep me up all night because I'm worrying about my kid getting home because he's not living in the neighborhood that that I want him to live in, to be able to come home at night. Those are things that are really, they're real things. Irritability, those things are real.
Yeah, and I think some of the other things that are particular to anxiety is uncertainty and fear and not knowing what to expect, not knowing what's in front of you, not having control over your day-to-day. You talked about job, you talked about finances, you talked about some other things, but the biggest thing around anxiety is stress, fear, uncertainty, and an inability to control the situation or situations that you find yourself in from a day-to-day basis.
Yeah.
And the reason why this is critically important is because anxiety medications are second, I think, or third most prescribed medications there are.
Yeah, man.
Any anxiety medications. And when you think about it, it's the stress that people go through day to day, the fear, the worry, the uncertainty, the doubt that they're able to do the things that they need to do, that they're able to accomplish the things that they need to accomplish, that they're able to, the fear, the doubt, the uncertainty with regard to their ability or inability to provide the things that they need to provide for themselves or for their families, as well as meeting the expectations that are placed on them from their jobs, from the businesses that they might be part of, and from the community that they are a part of, and even from the organizations that they're a part of. There's anxiety has been associated with the what is the right word, with the overindulgence that we have in life.
Well, that's obsessive compulsive disorder, believe it or not. That's when a lot of people become so basically their anxiety can manifest in many ways, and I really want to talk about this. Excessive compulsive disorders, which is people call it OCD, post-traumatic stress. We've talked about it. Phobias, generalized, they include physical anxiety such as heart racing, tension in the chest, butterfly symptoms, feeling of anxious and afraid, always just being afraid, walking around in fear, feeling irritable, always on edge, engaging in compulsion, right? Such as washing hands or doing something, we think about it, the cleaning up all the time, doing something, avoiding people and places that remind them of their past trauma, experiencing nightmares and memories and flashbacks, having trouble concentrating because they're distracted, having specific fears or phobias, developing anxious tensions, headaches, chronic muscle pain. Over time, anxiety really, really, really affects your health. And Black people experience it at rates, those are what you talked about, even though the white, again, counterparts, they experience a higher, it's more serious with us, if that makes sense.
Well, what you're talking about are the signs and symptoms of anxiety. So the things that you just talked about are things that we need to pay attention to. If we recognize those things in ourselves, hey, maybe I'm suffering from anxiety. More importantly, or equally importantly, if we recognize those things in the people that we live with, the people we love, the people we care about, hey, wait a minute, you might be suffering from anxiety. So there's a big difference between the causes of anxiety, which is what we talked about, and the signs and the symptoms, because the causes are things that we just can't really help. The signs and symptoms are the warning signs that alert us to, hey, maybe something's wrong, and maybe we need to deal with it. And so when we get to that point of needing to deal with it, we're going to go real quickly on this. Again, very similar to depression and very similar to every single mental illness there is. It starts with your initial physician who knows you better than anybody else. That person will ask you questions that you will answer, or your significant other will answer, and help that primary care physician refer you to a therapist or a psychologist. And psycho, again, we go back to what they call psychological therapy or psychotherapy, is basically where therapists help you walk through, the different events that trigger your symptoms. Very easy, I shouldn't say easy, but it's a very simple concept. Tell me about the situation you're in. Tell me about what happened, and then tell me how you felt. That's what psychotherapy is. That's what therapists do. That's what psychologists do. And they do this with the intention of helping you understand why you feel what you feel when you feel it. But the second reason they do it is to give you coping mechanisms and strategies that help you, okay, I'm going to be here. I'm going to be in this environment. I know this is going to happen. You know what? But I'm going to think differently. I'm going to feel differently. I'm going to act differently. And that's how I'm going to overcome allowing myself to have an episode of anxiety. And so, again, it goes back to what we talked about when we were talking about treating depression. It's basically this cognitive behavioral therapy. And from what the experts say, what the world of psychology says, is that this is the most effective form of psychotherapy for anxiety. And basically, in essence, what you do is you learn how to effectively handle the triggers that actually cause your anxiety. So you're preventing anxiety from happening, as opposed to having to treat it after it occurs. So the bottom line here, again, just to keep this real simple, if you're experiencing any of those signs that Malik just got finished talking about, or any of those symptoms that Malik just got finished talking about, contact your physician.
Yeah, and again, if you know anyone who's anxious, who's always just thinking or anxious thoughts, talk to them. We each one support one. And sometimes we all be, stop worrying about stuff so much. Stop doing that. No, you some people really do have that. And so if we know that, if we really want to help people, talk to them, encourage them to go get the help. If you see some of those signs in that we talked about in someone else, if you're close to someone, talk to them. Hey man, you know what? Why don't you think about this? Why don't you think about going to get the help that you need? So that, you can, have to worry. Because it's easy to stop worrying about it. No, then we quick to give them some Bible verses. Well, the Bible says be anxious for nothing. Well, no, it don't work that way. That can help, but, there may be some underlying stuff. And as we look at understanding that anxiety and depression do feed one another, so it's anxiety, like we talked about depression last week, but they kind of go together, and understanding that, so that we can really go ahead and get people help, and understanding, again, this is Mental Health Month, and we want to just bring awareness. And I just happen to be in a practice that deals with a lot of this stuff. And so we just want to continue to just encourage people. If you're feeling anxious, you're feeling overwhelmed, go talk to someone, go get the help needed. And, that's something we want to talk about again. And as we feed into, another disorder that's really prevalent in our communities, that is bipolar. Bipolar, which was something that was formerly called manic depression and manic illness, is a mental illness that causes dramatic shifts in a person's mood, energy, and ability to think clearly. People with bipolar experience high moods and very low moods, known as manias, which differ from ups and downs that life people experience, because we all experience ups and downs in life, but when we think about, what I want to talk about is really understanding what it is defined. It has a really high level of extreme moods, right? And so disturbances that affect our thoughts and behaviors, these are extreme. Like, I can be really, really up, I'm really high, I'm very, very, I'm ready to go, and then I'm in the basement. I'm ready to go, and I'm in the basement. And so, and that's why it's all bipolar 1. There are two different types, but again, I'm not a physician. We're not, we're just talking about it from our experience. Brett and I both have been in the field on different levels, so we understand it. And so we talk about it. We're talking about it from that standpoint, and we will have some clinicians here that can be able to help us one day, and we'll talk about it even more. But that's why both bipolar 1 disorder is often referred to as a manic depressive illness, right? It really is. I'm on top of the world 1 minute, and I'm at the bottom of the world the next minute. The rate of bipolar disorder is the same between Black and white Americans. We want to be clear on that, but we are less likely to receive the proper diagnosis and treatment. Brett, you want to talk? Tell me what's going on.
Well,
because that's something that I do see.
Well, basically, the reason why we're couple things here. We're under diagnosed, number one.
Yes.
And anytime you're underdiagnosed, therefore you're undertreated. So even though, to Malik's point, bipolar 1 or bipolar disorder, however you want to phrase it, is as prevalent in the white community as it is in the Black community, the Black community suffers from it more. It has impacted the Black community even more because it's undiagnosed or misdiagnosed and because it's undertreated. The other thing is they talk about duration and severity. The duration of the episodes that occur typically occur longer in African Americans. The severity of the episodes usually last longer in Black Americans. So the prevalence is similar, but the impact is much, much greater. So I want to talk real quickly about the signs and the symptoms, because it's really, really important to understand what they are so that you can get help. And again, I want to be clear about this. If you are experiencing bipolar 1 disorder, chances are somebody's going to have to help you get help, because chances are you're not going to be cognitively sound enough to get help on your own. Doesn't make anything wrong with you other than the fact that you have a mental illness. And so Malik talked about mania or manic episodes, and here are the signs and symptoms to look for. When somebody is up or manic or experiencing what they call a manic episode, they have excessive energy. They're racing. Their thoughts are racing. They're talking really fast. It's like, but da 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 da. They're all over the place. They're fast. They're just they need to be calmed down, but they can't calm down. They're always happy. They're experiencing extreme happy feelings. They're pretty much happy about everything. And then their behavior is aggressive. They can be violent. They can be, their behavior can be inappropriate in the given social setting that they're in. Whether they're home, whether they're out in public, it doesn't matter where they are. They can have aggressive behavior, and it could come from out of nowhere. And these things are acute. They're spontaneous. They're instantaneous. They happen. They occur. Bing, bing, bang, out of nowhere. And then the other thing I think is interesting is that patients with bipolar 1 or bipolar disorder, they have an increased sex drive, and they're not aware of the fact that they're unusually sexual or unusually aggressive when it comes to sex. But you got to watch that because I've seen situations, I've heard of situations, not personally, but from
You were in the field, yeah.
from the psychiatrists that I've spent 6 years with is
You selling, not you weren't under this care, right? I'm just asking.
no, sometimes I feel like I needed to be, but they will share experiences where they've seen their patients or have been told about their patients who have attempted sexual assault on people because in their own minds they don't think they're doing anything wrong, but they have this heightened, increased sexual drive. So you got to pay attention to these things. And the other thing is just what they term is just sustained unusual behavior.
And that includes, I want to cut you off too, in some severe bipolar episodes, mania, depression, also may include psychotic symptoms such as hallucinations and delusions, and we've seen that. And then also, and people with bipolar disorder may be, this is something too, that they may be wrongly diagnosed as having schizophrenia. And so, making sure that you're getting the right diagnosis also, because there are some correlations, but I've seen people be misdiagnosed also.
Yeah. And getting back to the manic episodes, the signs and symptoms of manic episodes, extreme paranoia is a big one. Somebody's always paranoid about something, fearful about something, and somebody who's also in consistent denial about things. They deny the things that they've seen. They deny the things that they said. They've denied the things that they've done. So these are the things that you want to look at when a bipolar 1 patient or bipolar 1 person is experiencing the mania side or the manic episode side. Now let's look at the depression side. There's also a newer thing called bipolar 1 depression. It's a newer disease state that over the last 5-6 years has been recently introduced into the mental health community or the mental illness community as a newer modality. And basically that is when a person has bipolar 1 disorder along with depression. So they call it bipolar depression. And so these are the depressive signs or the signs of depression that you need to look for because a person can go from, like Malik said earlier, from the high to the low. The high is called mania. The low is called depression. And so we're looking at sadness. We're looking at somebody who feels an incredible sense of worthlessness. We're looking at people who experience an incredible sense of guilt. They might have a lack of energy. But the biggest thing, in addition to that lack of energy, is a loss of having interest in the daily activities that they used to perform in. So when you see somebody who used to ride bikes, who used to work out, who used to play ball, who used to paint and cook and do all these different kinds of things that was part of their everyday life routine, and all of a sudden they stopped doing it, all of a sudden they lost interest in doing it, that's a person who could very well be suffering from the depressive side of bipolar depression. The other thing is, which is easy to identify, is that they're going to be either going through a period of time where they eat too much, or they're going to be going through a period of time where they don't eat anything at all.
Yes.
They go through a period of time where they sleep too much, or they go through a period of time where they don't sleep at all. And so, again, it's the ups and downs that make bipolar depression or bipolar 1 disorder, bipolar 1 depression, very, very difficult to deal with. It's treatable, Malik. It's treatable, but it's difficult to deal with.
Yeah, before we even get into the treatments, some of the causes. Let's talk about some of the causes. One of the things scientists and doctors have not yet discovered a single cause for bipolar disorder. Currently, they believe that several factors include genetics, right? So that's always right. The chances of developing bipolar have increased in child, parent, or sibling behavior. the role of doctors are saying the role of genetics is not absolute. A child from a family history of bipolar disorder may never develop the disorder. So, we want to think about that. Again, stress. Stress is so important, and that's something that we don't even understand. Really, have stress and disturbing events that have happened through life, such as a death of a family member, an illness, a difficult relationship, a divorce, financial problems. They can trigger manic or depressive episodes. So understanding, there are people who can go through all of these and deal with it gracefully. There are other people who, really, whatever that thing is that gets them, one of those few factors can really set them off. And then brain structure and function. And it's saying brain scans cannot diagnose bipolar disorder, but yet researchers have identified subtle differences on the average size of activation of the brain structure in some people with bipolar disorder. So, there's a lot of research still being done. Drug and alcohol abuse is a big one. Really understanding, when again, that spirit, you put in something that's disruptive in your body and you're already going through things. So really understanding, and I've seen it, drug and alcohol abuse, it correlates with bipolar disorder big time. And so understanding that is something. And then there are treatments, right? Again, we talk about, the power of treatment helps people with mood swings and symptoms, psychotherapy, support groups, psychoeducation. These are things that we talk about, cognitive behavior, what we talked about before, CBT. It helps you change the negative thinking and behaviors associated with depression. The goal of psychotherapy is to recognize the negative thoughts and teach coping skills and strategies. Family focused therapy, that helps people with bipolar, that helps the family members. And so it teaches you how to be supportive. And then psychotherapy focuses on self-care, self-regulation. It helps you improve in the areas of self-care. So when those symptoms, how do you start to manage when you're feeling that way? And so again, we really want to put a plug in for therapy. You got medications, all right? They're, again, going to see a psychiatrist, like Brett said before. It starts with your primary care doctor, but then your primary care doctor may refer you to a psychotherapist. A psychotherapist may refer you to a psychiatrist. Those are the ones that give you the medicine. And so understanding that, and they will understand the different types of bipolar so that they will be able to prescribe the medicine that is right. And so there are some different medications. Lithium is one that I know is used, and there are many others. So again, understanding that, and then understanding that there are the different treatments come with peer support. That's really big. Understanding to exercise, why exercise is important, doing those type of things. And again, we talked about, I think, a few months, maybe in this episode, the electro compulsive therapy, those are things that are treatable. It is treatable. And then you can have productive lives, but again, we keep talking about this, but we don't want you to do is go out here and feel, someone's crazy. Or I know someone's going through this, and, encourage people to go get help. I think that's where we are in this month of mental health month. We want people to be mentally healthy. Again, we're talking about mental illness, but the only way to identify mental illness so that we can get you mentally healthy is to go get the help needed.
Yeah, one of the things that I think it's real important to understand, if you're suffering from bipolar disorder or bipolar depression, or if you have a family member suffering from that, this is a chronic condition. This is something that's going to take a long time in some cases it's going to take a long time to resolve. In other cases, it might not take as long. But it's real important to be patient. It's real important to be tolerant. If it gets to a state of medication, I'm going to ask you to do two things. I'm going to ask you to be patient and trusting on one hand, but I'm also going to ask you to be aggressive and adaptive on the other hand, because different psychiatrists use different cocktails. They use different strategies with medicines, and all of them, every single one of them are what's the right word? Are tests. They're trying to figure out. They'll give medication to see how you react, to see if it works, and in many cases it doesn't. So they'll give you something in addition to that, and then they'll give you something in addition to that, and then they'll give you a different type of medication altogether, and they'll give you different medications and more different medications until they figure out how to manage the disease. And managing the disease is minimizing mania and minimizing depression. You're not going to stop it from happening, but the goal is to manage it so that you minimize it. And when the brain and the body responds to the right type of medication or the right cocktail, the body then responds, and it can become more normalized. But you have to be patient, and you have to be savvy enough to you have to be aware, alert, and savvy enough to understand whether or not this particular doctor and what he or she is doing, is it working or not?
Is it working? And the only person that can tell that is you, or the people who are or your support system. Yeah. So really understanding that.
Yeah.
Yeah.
Yep. Yeah. That's real important to know, because it's a struggle. It's challenging. I know people suffering from this disease, and
oh man, I've seen marriages break up over it. I've seen so much go on with it. And it's unfortunate because a lot of times the loved ones don't know how to handle it. And I've seen on some sides where the spouse just bails, at least the other spouse, helpless and clueless. So, it is a serious disorder, but with the right treatment, in the right, I want to talk about the support system, the right group support. I believe that, with it can definitely, help. And these are real things, guys. I want to talk about it. It's real. These are not pretend. And again, I want to destigmatize crazy. It's not about being crazy. It's about people who have some really hard issues that they're dealing with, and with the right treatment, right support, right diagnosis, people can live happy and productive lives.
And lastly, regarding the subject, to Malik's point, there are he talked about group and peer therapy. There are programs that help bipolar, depressed patients assimilate into the community. And what they do is they give them small pieces of responsibility in small increments, 2 hours a day, and then maybe 2 hours for 2 days, and then maybe 2 hours for 3 days, and then maybe a full day, and then maybe 2 or 3 full days. And they gradually work people up to the point where they can function in a normal way throughout the course of a given week. Of course, they're still on medication, and they're still doing the therapy piece, but they're assimilating patients into a normal routine and a normal work life.
And I want to give a shout out to NAMI also, which is the National Alliance of Mental Health. If there's anybody who ever needs help, they have a great organization, and you can just go to NAMI.com, and they are all over the country. They really do a good job.
Awesome. Okay, real quickly, switching over to schizophrenia. It's our last mental illness discussion that we want to have today. Schizophrenia is pretty deat, man. Schizophrenia. Schizophrenia is a chronic mental condition that affects thoughts, feelings, and behaviors, just like all the other ones. But here's the tricky thing about schizophrenia: it only affects 1%.
1%, yeah.
It only affects 1% of the population, but it's also the most difficult mental illness to treat. Now, several studies have occurred over the last 4, 5, 6, 7 years where Black Americans are anywhere from 2 to 4 times likely to be diagnosed with schizophrenia than white Americans.
Wow.
We talked about how small it happens, so it's a very low prevalence. But again, the prevalence is higher in our community than it is in any other community. And to make matters worse,
Access to healthcare.
okay, to make matters worse, experts admit it's very difficult to accurately diagnose schizophrenia. There's a couple of reasons why. In the Black community, symptoms are very similar to the other mental health illnesses that Black people experience. And because we tend to experience these symptoms more, there's a prevalence for us misdiagnosing, or I shouldn't say us, it's a prevalence for the mental health community to misdiagnose schizophrenia. So if I misdiagnose schizophrenia and call it bipolar 1, or misdiagnose schizophrenia and call it something else, then obviously I'm treating it inappropriately. And so when you treat something inappropriately, it makes it worse, and it prolongs what could be a potential treatment success. So anytime you give somebody the wrong thing, or you tell somebody to do the wrong thing, or you teach somebody to live the wrong way, not only you're not helping them, but you're preventing them from being helped in the areas in which they need help. And the biggest challenge with schizophrenia is diagnosing it and then how we treat it.
Yeah, even though there are no really chemical or scientific concerns, experts believe that the cause is genetics, family history. Those are things that environmental factors, poverty, oppression, that's really big. Trauma, again, and traumatic events, discrimination and the effects of racism. Those are things that are really, really, really important when we start to think about, the causes of schizophrenia. Genetics, isn't just cause a genetic variant, but a complex interplay of genetics and environmental influences. It says while in schizophrenia occurs in only 1% of the general population, the family psychosis is really important. So if there's people who are, if there's been a history of psychosis in the family, if there's been a history of those things, then we have to really start to look and pay attention to it. Exposure to different things at birth, but the environment you were brought up in at birth. Again, we talk about nature, nurture. That is really, really important. And then substance use goes back again to substance use also. There's a big factor in substance use that there are a lot of studies that talk about the mind-altering drugs during teen years can affect you and increase the risk of schizophrenia. And so really starting to understand that. Another study found that smoking marijuana led to early onset schizophrenia and often precede the manifestation of the illness. So really, what do we put in our body? Alcohol is another big factor of schizophrenia. So these are things that are prevalent in our communities. Again, my uncle was in the back room with the Thunderbird, really talking to himself. Was that schizophrenia, or was that, what was it? It was something. He had been in the war, right? He had been in Vietnam, and so we just thought he was shot out behind the war.
Let me jump in here real quick. What your uncle was going through, you said he was talking to himself?
Oh yeah.
Okay, so
right. So again, he's locked in a room, dark room, TV on all day, bottle of vodka, shot out behind a war, right? Post-traumatic, and a lot of those things. What was going on?
The two things that are most manifested in schizophrenia is hallucinations and delusions. Or so people are considered delusional or suffering from hallucinations. So you talked about a couple seconds ago, you talked about the different causes or the signs and the symptoms. The most important thing to really keen in on, the biggest cause of schizophrenia, because it's such a small
minority,
such a small
percentage.
prevalence, is
Yeah.
the trauma that people have that cause them to have an episode. And
Now let's talk about people who come home from that war, right? And we're talking about Vietnam in the 60s and 70s, right? That was something that a lot of people faced, right? They came home from that war, shot out. They came home from that war, in many ways, still hallucinating from that war, right? So those are things that I would love to know a study done behind something like that. People and the effects of that coming out of war, people affected, especially that Vietnam War and all of the things that happened. So, some of the other symptoms, like you talked about, hallucination is really big. These include persons hearing voices, seeing things, smelling things, talking to themselves, experiencing, voices that are telling them to do things to other people, voices that involve people that they known or unknown, and then delusion. These are false beliefs that do not change even when a person holds them to proceed as a new idea or fact. People who have delusions are often have problems concentrating, confused thinking, and a sense of thought that are blocked. Right. And so when we think about those things, these are real symptoms of schizophrenia, and they're real.
yeah, the simplest way to look at delusion is the concept of people not seeing reality as their reality, and just being delusional about where they are, being delusional about what's around them, being delusional about what's happening, being delusional about the weather, being delusional about any environmental condition that may be around them. And to Malik's point, when people are delusional or hallucinogenic, there's a imminent danger that they put upon themselves and an imminent danger they put upon other people.
So my delusion about my Cowboys winning the Super Bowl is for so many years, that's delusional.
Yeah. I'm not sure I'm not sure that's clinical delusion. I just think it's wishful thinking.
So that's the hallucination that I'm at the Super Bowl.
Well, that's one way of looking at it. I guess that's one way of looking at it. But I think the real important thing to realize, if you're living with somebody with schizophrenia, and not many of us are, thank God.
Thank God, right? 1%. Yeah.
It's important to realize that people are imagining things that aren't real. And when you imagine something that's not real, it affects your behavior. And so people will pull out a knife and try to stab you because they're delusional about who you are. People will pull out a gun and shoot at the wall because they hallucinate over the fact that they see somebody there that's not there. These types of patients can be very, very, very dangerous. And so you have to be really, really conscientious about getting them immediate help, which oftentimes becomes isolation until the patient can become under control.
There's something that the DSM-5, according to the DSM-5, and if anyone doesn't know what the DSM-5 is, the DSM is a diagnostic statistical manual of mental health, right? Mental illnesses. So it just gives you all of the mental illnesses. And it says, according to the DSM-5, to have schizophrenia, you must have at least 2 of the following symptoms. You must suffer from delusion, hallucinations, incurrent speech, poor motor functions, and the ability to perform normal day-to-day functions. So again, my delusion is I'm going to see my Cowboys at the Super Bowl. The hallucination is I'm at.
Hold on for a minute. Hold on. I appreciate the humor. I get it. There's no such thing as being schizophrenic as as it applies to rooting for a team.
No, I know.
And I know you're being funny, but I don't want to confuse people.
No.
There's a very serious nature about being delusional, and there's a very serious nature about being hallucinogenic if you are diagnosed as being schizophrenic. And to Malik's point, the DSM-5 is a manual that it's a how-to, when-to manual. And basically what it is it says, this is the disease, this is what it is, this is what you're looking for, and then this is what you do, this is how you do it, and this is how long you do it. And so psychiatrists refer to this as a believer would refer to the Bible.
Right. Yeah.
It's how you treat
any mental health disorder.
Exactly.
Right. So all of them that we talked about, depression is in there, anxiety's in there, schizophrenia is in there, and alcoholism is in there. So this DSM-5 is the Bible for mental health practitioners.
Yeah, and I think it's important to reiterate what you said, Malik. In order for somebody to be diagnosed with schizophrenia, repeat what you said.
Must have two of the following. You must delusions, hallucinations, incoherent speech, poor motor function, and the ability to perform normal day functions. And so what we're talking about, again, I was making a joke about, you have to have two of them, right? You can't just have delusion without the other one.
You have to, if I'm not mistaken, first of all, you have to have two, but if I'm not mistaken, the first three you read, and I know one is delusion, I know one is hallucination, and what's the third one?
Incoherent speech.
You have to have one of those first three.
Right.
And then you have to have one of the other two or three.
Right.
I forgot what they were. So if you have any of those two, then legally, I shouldn't say legally, clinically, you are diagnosed as being schizophrenic.
Right. And so, again, when we talk about it, we're not talking about it from a standpoint of, looking down, doing anything like that. We're talking about it from a go get help standpoint. Again, we want people to get help. We're just making people aware of what's really going on in our communities, and it is going on.
Yes.
It's going on, and it's prevalent. And again, if you get a chance, really, I love Trevor Noah does a great skit about why blacks don't go to therapy. It's on one of the YouTube channels, but it really is interesting. But we are suffering. But we have stigmatized this thing, and this is really an awareness to destigmatize and to let people know that there is help available. Again, we are here at Family Healing Center, and putting a plug in for www.familyhealingcenternj.com, and so we want to help. We want to help people. We want to see people's lives change and transform. And mental health is one of these things. Mental illness is one of these things that have held us back for so many years. And so understanding that, again, whether it's, anxiety, depression, bipolar 1 or 2, schizophrenia, and there are a lot more. Next week, we're going to be dealing with alcohol and addiction. So understanding that there are so many things that have held us back for so many years, and we're just trying to bring awareness and to break free from some of the stigma that's going on with mental health.
Yeah, I just want to add real quick before I close out. Real important to understand, there's no cure for schizophrenia. Once you get it, you got it. But it can be managed with treatment. And not going to spend a whole lot of time on this, but there are medications. They're called antipsychotics. There's a ton of them. It's fascinating to me the way I watched psychiatrists use different antipsychotics to treat patients who were in different stages or different forms of schizophrenia. You treat a patient who's hallucinating a little bit differently than you treat someone who's delusional. You treat someone who's irritable a little bit differently than the way you treat somebody who just doesn't want to get out of bed. And so they mix these cocktails and they do a whole lot of trial and error. And sadly, I've seen it. Sadly, some of these patients wind up in institutions getting inhalation medications or what's the word I'm looking for? needles. Needles is not the right proper term, but they're getting medication that's being given to them intravenously because they need to be calm. Number one, they need to be nonviolent.
Mm-hmm.
Number two, they need to be calmed down, and number three, they need to be put in a clinical, mental position to be talked to be reasoned with, so that treatment can then be made possible. If it gets to that, it's sad. I've seen it. It's a very, very painful and sad thing to look at. But fortunately, it doesn't happen to a whole lot of people. And fortunately, it can be prevented by taking medication, and it can be prevented by going through the psychotherapy that Malik talked about that they have here, where they really focus on preventing or managing the symptoms, diagnosing the triggers, and being able to walk through and talk through and managing thought and behavior so that the triggers don't win out, but your ability to think and your ability to feel and your ability to react overcomes the triggers so that you don't go into these schizophrenic episodes.
And just to let you know, because you have schizophrenia or any mental health doesn't mean that you can't still be functioning, doesn't mean you can't still be great, doesn't mean that you can't, it's just something you're born with. And, there was a famous person that we know, Vincent van Gogh, one of the people of the greatest artist ever, was known to be schizophrenic. And so, we want to understand that there are people who have, and, who live with this thing and can still have productive and healthy lives.
Absolutely.
Mm-hmm. So, again, we want to thank you for another great episode of Men to Men podcast. I know we're bringing some heavy stuff right now, and there are going to be times we have to do that. And there are times where we're going to, be light, but I think that this is really important, being that it's Mental Health Month, and, just bring awareness again. Brett, anything else you want to say to the audience?
No, thanks for listening. Hopefully this was helpful. Next week, we're going to talk about...
I believe we're talking about addiction, really, alcohol and drug addiction. Yeah,
substance abuse.
Actually,
next week we're talking about substance abuse and suicide.
Oh, wow. And
the following week we'll talk about addictions. So stay with us. Again, this is hopefully helpful. It's something we enjoy sharing, and you all stay blessed and stay healthy. And
yeah, it's the summertime. So again, thank you for another great episode. And again, we can be reached at Men to Men Podcast. Actually, we have a website, www.men2menpodcast.com. We can be reached at YouTube, Facebook, and Instagram. Thank you, and have a great week.